Good afternoon, everyone. My name is John Garfalo. I am your VP of Community Investment at the Community Foundation here in Akron. We are so glad that you all are here today for a very important topic as we at the Community Foundation conclude our education cycle. And many of you are grantees in this room in our cycle, and we appreciate your partnership. We appreciate your support. And again, we thank you all for being here. We'd like to welcome our President and CEO, John Paturis, who is in the room. You could say that for a few more months until he retires in mid-July. And welcome to our board members who are here, Sylvia Trundle, our immediate past chair of our board, Sylvia Wave. Thank you all for coming, as well as other members of our board and our Community Investment Committee. We realize that it's been a tough start to 2025 for many of us. Not only, hello, that's what someone said. We realize that things that are happening that are out of our control are affecting each and every one of us. Know that we at the Community Foundation hear you, we acknowledge you, we are here to listen to you any way we can. Know that when they made the announcements about grants being cut on a federal level, I took no fewer than a dozen phone calls that week from organizations who just, because of the uncertainty, didn't know where to turn. So know that your staff here at the Community Foundation are willing to listen to your concerns. We may not be able to help everyone in situations with additional dollars, but we know that we're here to be a listening ear for you. So we appreciate the partnership that we have with each and every one of you. On a happy note, our second annual Insights Learning Conference is coming up on March 13th. How many of you are already signed up? Very good. If you're not, spots are filling up quickly. We have about 170, maybe 75 seats still available. Once we sell out, we're not going to be able to take on additional registrations. So go to our website, talk to one of the staff here if you want additional information about the Insights Learning Conference. We appreciate the support of the Huntington Akron Foundation, who is presenting the conference this year, and thanks to our friends Ron Pato, Jen, and all the team from Huntington that are here today. We could not do it without your support, so thank you very much for partnering with us on that. With that, we have a lot to get to today, so I'll turn it over to my colleague, Christina Gonzalez-Acala, and who's going to moderate today's program. Thank you all for coming.
Thank you, John. Thank you everyone again for coming, and I'm excited for this panel. It is such a privilege to be in these conversations with them, and thank you also for being flexible with how we moved our date for this community sessions. We were working through some proactive grant making there. That got a little hectic for us. So that gave me enough time to just give them the easy questions. So I'm going to start by sharing just a quick couple of data points, because these are all great data-oriented people. But first, let me introduce you guys, right? So from left to right, I'll start here with Laura. Laura Franchuk, she is our TAPS program coordinator at Child Guidance and Family Solutions. We have Jennifer Douglas, supervisor of early learning programs at Akron Public Schools. We have Mallory Zahun, senior clinical consultant, early childhood at Child Guidance and Family Solutions. We have Beth Kelly, Chief Officer of Youth Advancement at Akron Area YMCA. And then we have Katie Durr, our Early Childhood Program Coordinator at Red Oak Behavioral Health. And last and the best, Angela Moses, Executive Director at the Early Childhood Resource Center. So thank you all so much for being here. And if you want to, you can scan this and you can get all of their bios as well. So let's get into it. The Center for American Progress shares that nearly 70% of children under the age of 6 have all available parents in the workforce. Let me say that again, 70% of children under the age of 6 have all available parents in the workforce. So like that's the case for my kid, right? Both parents work, but she's sick right now with her uncle, and both parents are here. So there's that. And yet the cost of childcare continues to push thousands of families into poverty. So what are our biggest gaps in Summit County's early childhood system, and what bold, scalable solutions could address these challenges sustainably? For the group, whoever wants to take it first.
Everyone's looking at me, so I guess
You know your mic, Angela, there? Because remember, Facebook Live over here.
Can you all hear me, or do I need the...
No, we do need the mic for the, sorry.
Well, I have some stats for you here because I think this helps us to understand sort of what the situation is around affordability. So a family with a household income of $65,000 with 2 children will be paying 29% of their income towards child care. So we know that child care is very, very expensive, and it continues to rise. So, for instance, in 2021, it was $10,000 for an infant, and today it's $12,000. So most families can't afford child care. And not only can they not afford it, but they can't even have a second child because when you add those numbers together, it's just unaffordable. And so that's one of the biggest gaps is really affordable child care and having quality access for all of our families here in Summit.
I'll go ahead and just add to that too. The state of Ohio is behind in publicly funded childcare. So Angela said $10,000 to $12,000 for an infant. Can you imagine a low-income family? How do they afford that? Right now, for publicly funded childcare in Ohio, you have to be at 145% or below the federal poverty line. That's low. Most other states are up to 300%. So there's that barrier there. And we really need to be advocating at the state level to make sure we have that funding in there for low-income families so they can attend the early learning programs as well.
So one more stat. Ohio ranks 51st when we count all the states plus DC in how much money we provide to publicly funded childcare.
Yeah, I just wanted to speak a little bit about how we're here talking about early childhood care, education, and mental health. And so I wanted to speak to the piece that if children don't have access to quality care, that often means that they are going to stay with a neighbor or a grandma down the road, people who do not have the same level of professional development that the providers at the YMCA or the early learning program that they have. So when they're not provided the same access to that quality care, they're showing up in pre-K classrooms or in kindergarten classrooms a little bit behind the ball. They haven't had experiences separating from their caregiver, engaging in same age peer interactions with their peers, learning how to be cooperative. And we see that when they show up at the classroom as well. So if the funding gap is not fixed, we're just going to continue to see an effect on children's mental health.
Let's stay on that funding piece. And so what role can innovative funding models, including the public-private partnerships, some donor-advised funds and community-led initiatives, play in making childcare more affordable and accessible?
One thing that I think, I'm sorry. I think that our community could explore are partnerships between employers and care providers. Is it possible to provide on-site childcare so while parents are working, children are accessing some opportunities educationally? I think that that's one way. I think also exploring ways to help, like Beth was mentioning, families that fall between that 146% to 300% of the federal poverty level, what options do they have to help mitigate some of the costs of child care? So I think that those are some things that we need to explore and consider.
Yeah, I mean, I think there are a number of ways that initiatives could really help in this area. We know that we have low staff who make very low wages. We know that there's a lot of burnout right now with teachers, and I'm sure Beth can attest to the staff turnover and the stress that a lot of our teachers are under. So it's not just that there are inequities around the cost of it. There's also inequities in the pay that our teachers are making, and not only that, but the amount of stress they have to endure when they have large ratios in their classroom. They have many children who are struggling with behavioral challenges, and they're treated unprofessionally. Many of them lack benefits and wages. Many of them qualify for publicly funded childcare themselves. And so it's really hard and not attractive as a field. And they're struggling as a field just as much as some of the other fields are, and if not even more. What we know here in Summit County is that 67% of our programs are to capacity, and that's simply because they don't have enough staff. And so, so initiatives could help with raising wages, they could help with professionalizing the field and really helping to communicate with the wider community about the importance of early care and education and the importance of this as a field and the investments around this. We know that 90% of a baby's brain is developed by the age of 3, yet our investments don't follow that.
I'll echo the workforce thing that Angela just said. It's definitely something that needs to be looked at and looked at very closely. It's a benefit of the Y. We're a large nonprofit, so we are able to give the benefits and pay a little bit more for our lead teachers. But I will say we have a lot of turnover when it comes to our aides and assistant teachers in our classrooms. And I know a lot of facilities are experiencing that too as well. So really focusing on that workforce and funding for that will help in general and help open more classrooms, provide more care for young kids, and hopefully keep people working in the workforce.
And a triple echo for the workforce issues. And as Angela stated, the majority of the brain is developed in those early years, 0 through 5. So it just continues to be a question of why are early childhood educators the most undervalued, or the reputation of that anyway. With the workforce issues being priority of the actual direct caregivers, speaking from the angle of a support agency going in to support these early childhood education centers and preschools, the workforce issues also trickle into early childhood mental health fields as well. So then it's really just this pattern, this revolving door of teachers being burnt out and the high turnover rate and difficult to retain them, and then also the support coming in as well, similar patterns.
In that revolving door, we were speaking about it, Laura, right before we started. And so, Laura, so you work with teachers to help them with any of the behavioral issues that arise in children in early child care settings. Mm-hmm. And I have here that according to our 0 to 3 partners, Laura, you're here, Laura DeCola, right? Oh, yeah. There you are. So according to 0 to 3, right, there was about, with 10 to 16% of young children that are experiencing mental health conditions. So what successful models exist for embedding mental health support, which, I venture to say that TAPS is one of them, right? But then, speak to that, but also speak to what you share with me in terms of what that revolving door of teacher does to a successful program like yours.
Yeah, I think when there's teachers that, are in and out, children, we all know that children need consistency. So when we have those teachers leaving and possibly classrooms combining, it's making things more chaotic for the child, not really knowing, day to day what room they're going to be in or who's going to be in their classroom with them, what teacher's going to be with them. So that's obviously going to cause a lot of stress, which makes it harder for them to learn, can cause a lot of other behaviors to happen in the classroom as well. What other questions did you have? Sorry.
Successful models for mental health and outreach.
So I think a key component to a successful model is having everyone involved. So it's not just the teacher that needs to do, her skills in the classroom. It's getting the parent involved. It's having the director be a part of that too. We've found in our program that when directors are very much involved in what is being implemented in the classroom, what we're modeling in the classroom for the teachers, when we're not there, having that director reinforce those things with the teacher is also very important. It's not just strategies given to the teacher and kind of, leaving them until the next time we see them. It's making sure those directors are on board too, and then making sure those same messages are being passed on to the parents with parent nights or individualized meetings with parents for specific children that need more support. So yeah.
Go ahead.
Yeah, I can also speak to this as well. I think our partnership, Red Oak, is partnered with the Early Learning Program. So I think we're blessed to say that we don't have as much teacher staff turnover. So children are consistently going to the same classroom, and that does provide a level of consistency. But speaking about burnout and things like that, no setting is immune to those things as well. So our program also focuses on this holistic approach. And so I think when you think about the 10 to 15% of children who have mental health disorders, I think that people probably imagine maybe like a middle schooler or a high schooler who's having like severe anxiety and depression. But the fact of the matter is I think that probably everyone in the stage is experiencing probably higher and higher instances of mental health concerns, particularly trauma. Trauma symptoms because of the early experiences that children have, whether that is instability, lack of access to quality care, abuse and neglect. It goes to impact their mental health. And so it's not just a middle schooler or a high schooler. We're seeing it with 3, 4, and 5-year-olds as well. And that's where early childhood mental health consultation, which is the center of both TAPS and our Red Oaks early childhood program, is that we don't wait until a child is a teenager and has significant levels of distress, right? And they're struggling to function in school and at home in order to get that child a diagnosis and treatment. Early childhood mental health turns that on its head and said, we know that early childhood 0 to 5 is the most important part, and we know that nurturing and supportive relationships is one of the biggest protective factors to I guess, slow or reduce instances of mental health disorders. And so both of our programs, I think, focus on making sure that teachers and parents are equipped with the tools that they need to continue to respond to those child's emotional needs, not just when we're in the classroom, but when that child goes home, that parent understands what their child needs developmentally, what they're struggling with, and how they can respond. We also provide things to children directly. So we do social emotional lessons. We try to give them the skills that they need to build a level of emotional resilience, helping them learn to identify emotions, express their feelings with other people, begin to manage some of those uncomfortable feelings, and frustration and anger come about at 3, 4, and 5 when you're sharing with a peer. We look at interpersonal relationships. And so early childhood mental health consultation is like a very holistic approach that we're looking at the child, but we're looking at the whole system that they grow up in, because children don't exist in a vacuum, right? And so we need to make sure that everyone has the skills they need to make sure that that child's set up for success.
So staying in that with the holistic models, right, and social emotional learning, the 2025 executive order on ending radical indoctrination in K-12 schooling has raised concerns about funding for social emotional learning. So how can Akron's and Summit County's early learning programs continue providing this holistic, developmentally appropriate education while adapting to these changes? And this is why I told you I was prepared for the easy questions for them.
Pass.
I don't know why everyone keeps looking down at me. Those were facts that were hard to put together. But you know, social emotional learning in early childhood, it's not separated from other development. It's all integrated. You can't say that a baby is learning some kind of academic skill outside of socialization. I mean, everything that children learn is in socialization. So you cannot separate social emotional learning from the child's development. It's integrated, and there's no way to tease it out. And I'm not a behavioral early mental health specialist, but I would venture to say that as humans, like, we can't separate that throughout our entire lifespan, because you have to have social skills. You have to be able to interact with folks and cooperate. It's all the great things about teamwork and our agency. All these things are part of our value system. So I'm not sure how you separate that out.
I agree. We have a number of children that come to us at the age of 4, and they've never been in a social setting. So 0 to 3, they were with grandma or a relative or a friend that whole entire time. And yeah, they knew their colors, numbers, ABCs, and all that kind of stuff, but they didn't know how to act in a classroom with 20 individuals and other kids and a teacher. So we are not, as providers, experts in mental health either, and that's why this partnership is so key, because if we're able to catch them at 4, hopefully we catch them at 0 or 6 weeks, but if we're able to catch them at 4 and work on that social behavior before they enter kindergarten, that's going to be key for kindergarten success. So yeah, it's very important to have those social skills. on top of those academic skills, but the social skills are key. And I'm sure all kindergarten teachers agree with that.
Also, excuse me, we know that out-of-school suspensions and expulsions are hugely problematic as children get older in school. Obviously, when they're not in school, they're not learning the things that they need to learn. Current research is suggesting that preschool actually has the highest rate of out-of-school suspensions and expulsions. So we're talking about children that are 3, 4, 5 years old being excluded from school. We have to teach what we expect, and we need help as providers to be able to really teach effectively all of those skills. It's a really complex, and like Angela said, you cannot separate out social emotional development. All development is integrated. And so the more attention that we pay to those critical skills so that children can stay in school, the better off they will be as they continue down their schooling path.
Any additional comments on what she just shared in terms of expulsions from kindergarten, and can you also share with the audience what TAPS stands for?
Yeah, TAPS stands for Toddlers and Preschoolers Succeeding. And so the main goal of our program is actually to reduce expulsion in preschool because it's 3 times higher than that of school agers.
I'm sorry, how much?
3 times?
3 times. Then high school, kindergarten.
Oh, yeah.
Okay, thank you. So
Yeah, kids are expelled for biting or, sometimes developmentally appropriate behaviors because teachers are not equipped to know how to handle those things. And so that's why I think it's so important to educate and train these teachers who a lot of times I feel because of the turnover, we are hiring unqualified teachers to be teaching preschool. So it's up to us to kind of teach them the skills that they would normally be taught if they were doing early childhood education in college. And that's hard, but I feel like it's really important because of that, the social emotional piece that really needs to be embedded and learned at this young age. So yeah, expulsion in preschool is, I know people are shocked by 2-year-olds getting expelled, but it's so common. And yeah, we just hope that more programs like that have early childhood mental health consultants continue to grow because the need is just so high, I think, everywhere. And everyone is so appreciative when we come in to help. A lot of the feedback is, we wish you were here more. We need you here more. We got a lot of feedback recently that said, can you come more than once a week? And we would love to, but there's not enough of us. So, yeah.
And why is there not enough of you guys?
That's another big question. We're not. I think it's a hard field. Burnout is a real thing for us too. I think we need to be paid more for what we're doing. So again, it's not.
It's okay.
It's not an easy job.
You're listening.
Yeah, it's not an easy job, and it takes a toll on the worker and just as teachers. I mean, it's a hard job, so we need to be compensated. So, yeah.
Well, I'm gonna move on to this other initiative. So the Make America Healthy Again Commission is prioritizing childhood chronic diseases, including mental health. What opportunities or risks does this initiative present for early childhood mental health services in Summit County? And how can local providers influence its implementation?
I'm just going to validate. There's just a lot of unknowns. We just don't know. We know the stats. We know the importance behind it, and it's just, again, validating the scary times that we don't know what's to come. When I was researching the policy or order or whatever you call it,
the commission
and
its initiative.
Thank you, the initiative. Of course. It sounds like there's 100 days before an assessment is released. That's what I was reading about. So, I know myself, a lot of anxiety surrounding that, and that's not even touching on the families that we're supporting. So, again, just validating the unknowns and the scariness around it.
Yeah, for sure. I think that we definitely probably feel a lot of uncertainty. I like to be an optimistic person, so I'm going to talk a little bit about the optimism that could come from it potentially, right, if we're focusing on mental health disorders. And that would mean hopefully more funding, and that would mean that the kind of issues that we're talking about here, we could start to see those kind of chipped away at. That's on the really positive side of it. That would mean an expansion of programming, more sites served, more of us to go out and connect with more sites, more classrooms, more children served, and we can start to whittle away at that 10 to 16%, right? Because early childhood is really important, and that's where the work is happening. On the flip side of it, there is kind of some of this uncertainty because policymakers are not always on the front line of things, and so they're not always in the classroom with us, right, and able to see the work that we're doing and how it's very, very important. So someone might say, okay, we're looking at mental health and we're focusing on treatment and diagnosing, right? But mental health is a whole continuum of care. And so if someone decides to focus on that part of it, that would mean a loss of funding on our side of things, on prevention and early intervention. And so I think it's really key that all of us here on the stage and those of you in the room with us continue to have conversations about how important it is for these young children to have the services and the support that they need so that they can hopefully not go on to develop a mental health disorder. So I think it's about us to continue to educate what we're talking about in here today and doing your own research so that policymakers know and understand that this is where we start. At 0, at 1, at 2, at 3, at 4, at 5, not once someone's in significant distress.
And just to add one thing, thank you, Katie, for twisting back to the optimistic angle. I was thinking earlier, one other positive thing that could come of it is just bringing attention. So kind of like piggybacking off of what you were saying, there's a lot of stigma associated with mental health and seeking mental health supports. So just bringing that attention to the need for mental health. Even, a lot of people will ask, infant early childhood mental health, what is that? What is mental health in a baby? Not understanding. So I do think that it could bring up more conversation and emphasize the importance of early childhood support.
You all mentioned the uncertainties, right? And if I may, since I have the mic and I do put this together, I'm going to tell a story. Taking advantage that you guys are here. Maybe I get a free session here. I came back from Mexico from being with my grandparents, and probably a couple weeks later, I was on my way to pick up my daughter, Izzy, who's 7. So a little outside of the early childhood space, right? But went to pick her up, and as I was waiting on Caroline, I was perusing Instagram, and there was a notification from one of the people that I follow in a story, and it said, ICE raid at North Hill, right? At North High School, I think. I live in North Hill. And so Izzy was coming with me to the house. And so I paused and I looked at that, and I get in Caroline waiting for Izzy, and I was like, shoot. So she got in the car, and I took her to Applebee's in Fairlawn, one of the whitest places I could find. And I said, excuse me, we're going to have a little bit of a conversation here. And I emphasized, right, because you guys have shared to talk to people and prepare them. I'm like, this is a conversation. Again, this is my 7-year-old. I'm like, Izzy, this is a conversation about us being prepared and not about fear. Or I need to share something with you. The reason we didn't go home right now was because, my mom found out that there were some enforcement agents from immigration that were patrolling the area, and Mama doesn't have her papers with her. Again, this is about playing shit, but you have papers, right? I'm like, yes, we do. They're just not in my bag. They're secured where they are, and they don't get lost, so that I can come and back and forth. And so I kept having this conversation. I explained what the raids were, why there was a likelihood of me being picked up in one of those raids, given my skin color, my last name, and saying to her, she said, well, why would that matter? And I was like, well, because in the very unlikely chance that I got picked up, I get put to a van, and you get put in another van. Do you know your mommy's cell phone number? No, I always get confused between hers and yours. And I was like, right. You would have to call mommy, and then mommy somehow would have to figure out that you were in the other van because I won't be able to talk to anybody until they process me and they figure out that I have my papers. These are conversations that many families in our community are likely having. These are conversations slightly different that other members of our community have been having for ages, particularly those with Black boys in their families. What young children are exposed to in the conversations about instability, discrimination, or the potential loss of rights affecting their families or community, how does that impact their emotional and psychological development? What are the long-term risks that stress can provide if left unassessed?
Thank you for sharing your story.
Thank you.
Yeah, I think that's the story that many families are having right now. I actually was at a school, not at North, but I was at a school. We do have two preschool classrooms at North High School. And so when I saw that post, I was also very concerned, like, oh no, should we go over there? Are they safe? All of those things. So we want to jump in and be helpers and make sure that people are prepared. I know on Red Oaks, and we did provide some red cards to families to help them know what their rights are. But it's a very scary time for a lot of families, honestly, right now. I think that, I like that you said, like, providing, I don't remember exactly what you said, like providing education and being prepared rather than fear.
For planning.
Planning rather than fear. I think that this instability and uncertainty is kind of like laying the groundwork for some anxiety, right? And to be in that state of stress for a very, very long time is very taxing to young children. Their brains are developing at quite rapid rates, but it is still developing. And it can be really hard for them to wrap their heads around what is like an immediate fear versus a hypothetical situation. It's very challenging. And so when we see this chaos or uncertainty, whether it's because of these new executive orders or other challenges that people have been facing, we see children with externalizing behaviors. They're creating chaos. They're coming to the classroom and creating chaos, or maybe they're more withdrawing. They're very quiet. They don't have as much energy. They're in their head and they're thinking. And I just think that's what difficult that is. My child is not quite yet 2, so we're not having conversations like that yet. But I just think that that is so sad and so challenging that so many young children now have to have that planted in their head and are having to have these conversations and think about that. If it goes unchecked, right, then we are moving towards, you know, an anxiety diagnosis and things like that. But I think that parents and mental health providers can partner together to talk about how do we navigate those conversations, especially with early childhood, because we don't want to overwhelm them and tell them that the world is a scary place, and it is scary. It is a scary place, right? But we want them to feel that mama has got you, right? It is a scary place out there at times, but I'm doing what I can to protect you and keep you safe. And so I think being able to have a plan is a great idea. Being able to talk with a mental health provider to talk about how we can conceptualize those things for a way that your child can understand and feel like they're planning for something, but also can help them feel resilient rather than feeling overcome with fear.
Yeah.
And yeah, I want to say again, thank you for sharing, but also praise you. That sounds like you did such a good job. But no, for real. Because what I had noted on the questions that you provided was very much what you did. The maintaining the focus on safety and reassurance, maintaining as much consistency as you can. So you just explaining to Izzy, like, this is why we're here, this is why we didn't go home, and focusing on the planning, like you said, rather than fear, was really important. So I know she's 7, and when we're thinking of even just a few years younger, their developmental level is so different, and their communication skills are so different. So just, like Katie said, mental health providers being able to partner with parents and caregivers to have developmentally appropriate conversations with their children regarding these areas. But again, definitely emphasizing the themes of safety and reassurance in that capacity would be very important.
And I just wanted to say one thing too, is like making sure that adults are taking care of themselves. And so you think about like the airplane, make sure you put your mask on before you put your child's mask on, and it feels counterintuitive. But I think that adults focusing on regulating and being a calm, you could be very unregulated here in your mind, but being able to be a very calm present for your child so that they understand, like, this is scary, but someone has my back through this.
I applaud you for having the conversation. I think as adults, we tend to shy away from some of those really difficult topics with especially young children because we don't think that they notice or we don't think that they understand. And they may not fully understand, but they absolutely notice when people around them, adults or children, have some dysregulation, have some worry, have some anxiety, and without giving them the opportunity to express some of that, they don't necessarily know how yet to handle those emotions and process them. And so it's really critical that we do proactively seek out what they're thinking and feeling about something. Even if we don't think on the surface that it's impacting them, it probably is. And then I think it's also, excuse me, important to keep in mind that these are not one and done conversations. It's very likely that, Izzy's gonna take some time and think about this, maybe hear some stories at school.
I got a call the next day from her teacher. She said, just want to let you know, she was talking to a little friend on the lunch and they were talking about ice raids. I was like, yeah, great conversation. The teacher was really impressed about it and I was like, yeah, unfortunately I had to have that conversation yesterday. So yes, the teacher did share.
And it's likely that that's going to maybe come up for weeks, months, maybe even in a year or so. Like, those kinds of fears don't go away. And I'm a little bit nerdy about some brain research, but like those stressors create all kinds of different hormones in our brains that can impact the structure, the physical structure of your brain. And so when little tiny brains that are still completing the majority of their development are being flooded with those types of chemicals that are impacting the structure of their brain, that then lasts their entire life. And so it's so critical for us to try to provide those protective factors as best we can and as early as we can. Because that's the only way that we're really going to be able to combat some of those detrimental impacts.
What are some of the signs that you might see in the children that are going through these maybe unattended emotions? And then how do you guys provide support as each of your professions allow?
We call TAPS. No, I would just add, you spent that time with your daughter and that's wonderful, but a lot of the families we serve, it's a grandma that's taking care of the kid. Kids in foster system, parents are busy, single parents, and they don't have time for those conversations. That's why it's really key that there's a lot of partners and people in the room together to help foster that with the kid. So it might be their early childhood preschool teacher and their mental health consultant really working on those skills, because a lot of times there isn't that adult there, there isn't that mom there to be able to work through that with their child. And so that's why these partnerships are so key, because we can be that person for those kids.
As far as what it looks like, it can look like so many things, and that is what can be tricky sometimes about young children's behavior. But it might look like fight, which might be, screaming, kicking, pushing, yelling. It might look like flight, running away. It might look like freeze, we're just frozen, we're hiding. It can look like so many different things. I think that what we try to do as best we can is, keep people safe and then co-regulate. So just trying to provide a very calming presence, and whether we're working, modeling some breathing or modeling some positive like mantra and self-talk to just help give kids the language to help soothe themselves. So hopefully that when they face that emotion again, they have some tools that they can begin to use. But it takes a long time, and it takes a lot of examples and consistency for them to really trust those strategies are going to work.
Sorry, I lost my train of thought. With children, with very young children, their verbal skills can be very limited at times. So just like we've all touched on this, the importance of recognizing children's behavior, whether it be the fight, flight, freeze, whatever it may be, and knowing that they're communicating something. So it's sometimes impossible to know exactly what they're communicating, but just again, educating all the grown-ups in the lives of the little children that behavior is a form of communication, so we need to be aware of that.
And I think there's like a lot of different ways that you can help kiddos not only process feelings but understand feelings. And we do that a lot in the TAPS program, is not only bringing in activities to help introduce and get them to learn and to identify different feelings, but also ways to manage their feelings, and recognizing that that can look very different for different kids. So some kids might need to dance it out. Some kids might need to go to the calm down corner and have all the sensory toys, and to hug a stuffed animal, or to sit and read a book on someone's lap. Or maybe they need someone to do some like pressure, yeah. So there's so many different ways, and you really kind of just have to try a lot of different things until one works. And it may take a while for a teacher to really figure out which one works for the kiddos, and it can be really frustrating. And so that's why we're there to support them in trying things and reminding them that like something's gonna click. We just have to keep trying. We have to keep plugging away at it, because one thing will click. But yeah, I think definitely the education and teaching the teachers that these aren't just behaviors, that it's a way of communication. And I think that helps with their frustration level. You know, when they know that they're not doing this to make their lives harder, or they're just not listening, they just want to be difficult. No, there's always a reason for these behaviors to happen. So the more they recognize that, I think they're able to stay calmer in the situation. So yeah, that's definitely one of the things that we work on.
I just wanted to say, you know, when we think about the instability right now of the workforce in early childhood, and we think about the turnover and the number of new teachers that are coming into the classroom that are not trained, not educated, don't have the tools they need, and then you think about Izzy, you know, and her going into her classroom and having a teacher that can be there to sort of buffer the kinds of things that are happening in her home and in her family and the stressors that those families have. We're not there, and we're in a crisis. You know, the teachers don't have the tools they need. They're not paid what they deserve. They're not considered to be a professional field. There's just lots of challenges that we have. We just don't value our young children the way that we should. We don't put the investments where we need to, and we're creating more problems for our children when we're getting more stress in those classrooms because they don't have those support staff that they really need at those very critical ages.
I think too, those teachers come with a lot of baggage as well, and things that haven't, you know, maybe they were little kids in a similar situation when they had they were in preschool and they had a teacher that was, you know, struggling to manage their classroom and other traumas, but so I think that's the other key component, is taking care of the teachers. So when we have those teachers, making sure they're taking care of themselves and advocating for self-care and other benefits for our teachers, because yeah, we want our leaders to be resilient like we want our kiddos to be resilient. So we can't just expect our kids to become these resilient beings without having resilient adults around them. So making sure we're supporting that and providing that support and different programming, I think is key.
Last question. This one this is geared towards you. Because, you know, APS introduced full day pre-kindergarten in 2024-2025 school year, and it's expanding it further 25 and 26. What are some of the things, I wrote down measurable, you know, impact so far, but I want to go easier and just be, what are some of the differences you've noticed in students as you guys move forward to next year, and what are some feedback from educators and parents as to what's been most surprising or most insightful?
Thank you. Thank you for lessening that question, because I was going to say the data is still, you know, like incoming, and I don't know that we're going to know the full impact for a couple of years maybe. We want to see how our children that are being able to participate in a full day program, how they look in kindergarten, how do they look in second grade, third grade. But we've definitely had a lot of learning opportunities this year. One thing that we've tried to be really mindful of is that a full day pre-K classroom should not be the new version of kindergarten. You know, you hear how kindergarten right now is the new version of first grade. And we cannot continue to push down those types of demands to younger and younger children. They are not developmentally ready for that yet. And if we try to skip over some of that critical development, we're going to create bigger problems down the road. Part of the reason I think that we see some difficulties with you know, social emotional skills and behavioral skills and things like that are because as educators, we have, due to various policies, you know, kind of push some of that aside so that we're focusing on those core academics. And we really need to make sure that in preschool and pre-kindergarten, we're trying to focus more on that holistic development. So all of that to say, you know, we've spent a lot of time this year and energy trying to find that balance of what is developmentally appropriate, what is play-based but intentional. How are we making sure that we've got learning goals that make sense and we're providing opportunities for kids to engage in experiences that drive them to those goals. We certainly have not yet, you know, found that magic formula, and when I do, I will make millions of dollars, right? we're not there yet, but we're gonna keep working on it. It's been interesting to see, like, we're just getting back some of our mid-year data. We use the GOLD assessment in Akron Public Schools, and so it measures several different areas of development, including social, emotional, cognitive, language, and so we're just getting some of that mid-year data back, and we are seeing some promising gains from observational data that our teachers are taking and you know, the experiences of our kids. So I'm hopeful that these experiences as they enter kindergarten are going to be beneficial. And I think we're just going to have to keep working on it until we get the right, you know, combination of experiences. I think that families are generally thankful for the opportunity to be able to provide a pretty economically, I guess, sensitive, that's not the right word that I want, but available option for children that may not have had a full day option available to them previously. You know, and we certainly want to be able eventually to provide that to more and more children. And I think we need to make sure that, you know, what we do have in place is strong so that we can scale it up. So I think at first our growth is going to look kind of slow, but I think then once we get there, we will be able to expand more and more. Thank you.
Panel, we're good? All right, I think we're good for opening into questions from our audience. I'm sure there's plenty of those. Not that Rochelle wants to ask one, I'm sure she does.
I'm Rochelle Wardell with the City of Akron. I always love listening to you all and sharing. I learn something new from you guys every time I listen to you speak. And that's something that we need to do more of in our community, I think. Listen to the people who are doing the work. And so in that way, I'm so mad at you, Christina. in that way, I wonder, like, how can the community support you better, like, right now? And what can we do as a community? Like, we talk about wrapping around the kids, but how can we wrap around you as providers?
Beautiful question.
Help with investments that support early care and education expansion in Summit County.
Ditto.
So yes, financial support, absolutely. And also just being aware of the struggles and the patience and the grace, that I'm sure we all entered this field to help. We want to help. So just being mindful of that. And we're trying our best.
And I think, talking about it and raising awareness and making sure that everyone understands how important, obviously you're here, so you know how critical it is. But, continuing to expand that awareness that, cute babies are cute, but there's so much going on behind those cute little faces, and we need to do our best to nurture that.
Do you want to go?
I think there's a number of ways that we can invest. We definitely know that teachers need more support. We need more professional development. We need their wages to be increased. We need advocates at the state and federal level to, because investments are not going to just come locally. We need those at the state and federal level as well. So really being champions, messaging, communication, just really getting the word out back there about the importance of early care and education and about babies' brains and their development. Supporting high quality, there's so many different ways. I think that there's so many pieces of legislation right now at the state level, and one in particular that we're really watching is around categorical publicly funded childcare. And so there's some legislation right now that would really support people who work in childcare having their childcare paid for. This would be a game changer not only for the family, right, encourage more folks to come into the field, but it would also mean that the childcare programs who hire staff who bring their children in wouldn't have to give that for free. And so if you think about already tight margins, right, in budgets for childcare programs, and you have 20-some children out of 100 rolled, let's say, and you're providing subsidies for those children, that's reducing your revenue when you already have tight margins. So being able to provide that publicly funded childcare for those families who already probably qualify would, I think, be a game changer not only for sustaining the program, and we have challenges after these ARPA dollars are gone. We've seen a huge cliff. Many childcare programs were subsidizing wages. They were helping with recruitment and retention of the workforce, and those dollars are gone. And so now they're having to try to sustain those budgets. And I told you earlier that many of our programs in Summit County are not at full capacity. So it's hard to, it's already a budget that doesn't work in childcare. But then when you take 67% of the enrollment, or their enrollment is 67% of their capacity because they don't have the staffing, and they don't have families. There's a lot of families aren't even coming anymore. They found alternate care options, and we're not sure where these children are. I had shared earlier with Katie that there's like 6,700 babies born in Akron a year. There's 1,200 children in childcare right now. We get enrollment numbers. So where are all the babies? So we know that in childcare, like up to 18 months, there's like 9,000 babies that could be in childcare. If we think about an infant room is 1 to 18 months, where are all the babies? Our babies are not in childcare. They're not in high quality early learning environments. And that's a little scary because we know that when we have those sort of stable places for babies to go, that they get the developmental and socialization skills that they need and the support they need from their caregivers.
Oh, okay. And beyond, obviously we want everyone to have access to high quality childcare, and we want staff to be equitably paid or, funded for the work that they're doing. They're highly valued. Like Laura said though, right, it's a stressful job. And so even if they are paid more and we have more kids there, there's still a lot of stress that comes along with it, and children still have needs. And so our mental health consultation programs are grant funded, and so we could use some funding too. Teachers are always saying we need you more. And so the problem is that we don't have more dollars kids or more staff to expand to those other sites. And so I think that that's where money can be invested as well.
I would just add really quickly about advocating at the state. One resource, or I'm going to speak on Groundwork Ohio. If you don't know them, get to know them. They can help support their advocacy. They can talk about mental health, publicly funded childcare, and where the money needs to go. They have an advocacy day where you can go talk to in Columbus. It is a great organization, and they want to help support early childhood 100%. So follow them if you don't.
Hi, Hannah Horgan. I'm with AMHA's Early Childhood Initiative. So we're talking about like state legislation coming out of DeWine's office last month. I know a big part of his initiatives, and he's really been a big proprietor for home visitation. He's looking to fund in the budget proposal an additional like 15,000, 20,000 families receive early childhood home visitation. How do you kind of see that fitting in with the programs you guys are doing and the families you guys serve? And then logistically, like I think about our agency doing home visiting, like to serve that many more families would be such an undertaking, right? Because then it takes on onboarding and training, and there's costs associated with that. Is that included in that, budget expansion? What does that look like to implement? So how do you, I guess, see that fitting in? And with ECRC Spark Ohio program, do you guys foresee anything on the horizon to expand with those efforts?
I'm going to answer the second part of your question. I love the idea. Well, I'll talk about the home visitation first. I love the idea. I think what I read was that every baby that's born would get home visitation, and it does not, income eligibility is not a criteria. So I love that idea, because I remember when I brought my baby home, I had no idea what to do with my baby, and I'm an early childhood person, so I really kind of looked at them. I think the first time they had like diarrhea, I really had like no idea like whether this thing was broken. I needed to return it. So, but I think that home visitation is so important. Obviously, the Spark program. And I know that you also run a Spark program here. We're not sure if Spark's actually included in that. There is some language about, expansion in other types of home visitation programs, but it kind of sounds like it's Spark to 3. But we get an earmark in the state budget. For those of you that don't know, our agency runs a program called Spark, supporting partnerships to assure ready kids in Akron Public Schools. We just recently also expanded in Springfield, and so we're pretty excited about that, thanks to some additional funding that we recently got. But the program is a home visitation program for 3 to 5-year-olds, and it goes into homes and works with the families. But beyond that, and it's around school readiness. Beyond that, though, it really supports families in having sort of a coach to help them through those 3 to 5 years. Understanding their child's development, what's happening, how they can support their child, how to connect with their local school district and ensure that child gets enrolled for kindergarten. But while they're out there, they develop such a partnership with those families that they see an infant in the home, and that infant might need support, so they can connect them with resources. So we feel, and I'm sure AMHA feels the same way, that like what a privilege that someone opens up their door and lets us in their home to be able to see their world. Not many people get the opportunity to do that. So home visitation is very critical, and we are at the state level right now trying to secure our earmark of, we get $1.1 million in the state budget. This is our second biennial year to get that, and we're hitting the ground running really hard trying to save that. We have 2,000 children across the state that really rely on that money. So we're advocating, trying to maintain it. At this point, we're not trying to expand, we're trying to just sustain what we have. Expanding in small pockets in Summit County and in other areas across the state. But thanks for asking. Sorry to take so much time.
One of my favorite quotes is Abraham Lincoln, who said that no man, and I would add, or woman, stands as tall as when they stoop down to help a child. So thank you for all of what you're doing and your remarkable work. As we hear about this threat of the Federal Department of Education being eliminated, And if that meant the money doesn't go away, but the money would be distributed to the states, given our governor's inclination of support for families and children particularly, learning particularly, would you all be encouraged or hopeful if something like that happened? Or what might that project for what the future could look like, please? Bam.
That's a tough one. I, for one, think that balance is critical. So, although right now our governor is very interested and works hard to make sure that early childhood is increasing in their opportunities and their services to children and families, I don't know that we can always rely upon that. And so I think that there needs to be some balance between opportunities that are provided at the federal level as well as at the state level. I think that they need to work together. But I would honestly love to hear what my co-panelists have to say about that too.
I think if I was a school district, I'd feel very challenged right now, just because, you know, when you spread funding out I'm supportive of choice, definitely, but I'm not supportive of spreading funding so thin that nobody has the proper resources they need to support children. And so I would feel very challenged, I think, and I'm not a school district, so I can probably say that. We've been very grateful for DeWine's focus on early childhood and children and families. Are we concerned that 2 years from now that could change and shift? Certainly. I think all of us, right now are very unsettled. Just in the last, I can speak for myself, in the last 2 months, unsettled. Our agency, 80% of our funding right now is federal pass-through. So, my staff are asking me if they're going to have jobs, whether we're going to be able to continue to fund the projects that we have. And my answer is, I'm not sure right now, what's going to happen. And so, yeah, it's just unstable. It's unsettling.
All right. Well, that concludes our panel. Can we please have a round of applause for our amazing panelists?